So welcome, dear friends. I think we know a majority of people that are on a call. It's my greatest pleasure to welcome you to the launch of white paper that was designed especially for the region of Europe. White paper that was designed together by two patient representatives, so Digestive Cancer Europe collaboration with European Liver Patient Association. My name is Marco Coreniat, and today I will just give you the welcoming words, and together with the friends from DiCE, we will just lead you through this event. So few journal rules about the engagement. So if you have any kind of question that you would like to ask, please do send it via chat or send it to the official emails, or we will deal with the questions at the end of the presentations if we had time, or at the end of the whole event where we have planned for questions and answers. Please be aware that we should mute yourself if you are not speaking. If you are listening to the conversation, please mute yourself. I should say that as all events, also this event will be recorded. After carefully examining the recording, we will then put it also on YouTube and other social media where it will be available if you want to see it again. So what can I say at the beginning regarding this white paper? So the idea of having a white paper came like 2 or 2.5 years ago already. And then we have set up a few teams that were working very hard together. So this is like a culmination of a work that was going on for a year, where we went to different patients, where we went to different stakeholders, where we went to different doctors, and collected through interviews their opinions about what needs to be done and changed for liver patients, liver cancer patients in Europe. And we compiled everything together in a small document with all the bullet points that we think are extremely important and we saw that are important for liver cancer patients in the region of Europe. And through this welcome, it's my greatest pleasure to collaborate with the Digestive Cancer Europe, which is organizations that we're collaborating on several different projects and also on this one. And during this collaboration, I met Zorana Maravic, which will be the next speaker to give you an introduction. But I just wanted to have a personal note regarding her presentation. So when I met for the first time Zorana, we had some ideas what can be done, and I was super impressed by her clear thinking process. So she knew exactly what needs to be done or how should we proceed to come to the end, to the final stage, to having a white paper as we have it today. Also during the process, she was very motivating at our meetings and give us a boost when we stopped working on the document and we wanted to have like a fresh idea or fresh view. So it's my enormous pleasure to introduce to you Zorana. She's working as a CEO of DiCE, and Zorana, the floor is yours.
Thank you, Marco, and thank you really for this very kind introduction. It is really a pleasure to be the host of this event today together with you. And I have to say that it's really a pleasure to see how we are working together to beat liver cancer jointly with ELPA. We started more than a year ago, but then last year during October, the Liver Cancer Awareness Month, we organized the first meeting jointly with DiCE and ELPA, with DiCE and ELPA members. And I think it was just the beginning of a very successful collaboration that resulted in this white paper that we will present today. I have to thank also my team for the great work that they put in producing this white paper and in organizing this meeting, but also to thank ELPA's team for their support and the great work that they put into it. And I have a small ask from my communication team. So they are asking if you could all turn your camera so, you know, we see your faces and we take a quick photo of people that are together on the call with us, and we show the support for Liver Cancer Awareness Month and also for liver cancer patients. Yes, thank you. So Katie, I guess that you will take photos, but I will continue for the sake of respecting everybody's time. So the next speaker today is Dr. Teresa Casanovas Taltavul. And Teresa has also been very supportive and instrumental in this white paper and has been guiding us because of her huge experience that she has in the field of liver cancer and liver disease. So Teresa is a hepatologist from Spain who has been working in the area of liver disease, for more than 40 years. And today is the president of ASCAT and board member of ELPA, as well as the coordinator of ELPA Scientific Committee. So Teresa, welcome. It's a pleasure to have you again here during Liver Cancer Awareness Month on this event.
Thank you very much, Sorana, for your introduction. Good morning, everybody, and welcome to the presentation of the white paper on liver cancer. The white paper is calling for increased equality and best practice implementation in the prevention, diagnosis, and management of the liver cancer across Europe. I am here today as ELPA Scientific Committee Coordinator and liver patients representative. I am glad to present this work. It contains a comprehensive assessment of the process of liver cancer, associated problems and possible solutions, and it's relevant for people in Europe, but also globally. This white paper on liver cancer is important from the scientific point of view, but also for all citizenship. Liver disease and liver cancer are increasing and can affect everybody. This document is a proposal from groups of patients in Europe, and we present its objectives in 5 areas needing optimization: knowledge, prevention, early diagnosis, treatment and care, and patient involvement and empowerment. What the patients need? Some unmet needs of liver cancer patients, gaps and barriers are the following: information about prevention of liver diseases even before development of liver cancer, surveillance programs in those patients at risk of liver cancer, an early diagnosis allowing better therapies. They need a coordinated care and correct decisions. Multidisciplinary team is crucial since the beginning. Better survival with updated medical therapy, possible sequential or combined, and new strategies for liver cancer, not only approved, but also available and affordable. Clinical trials with new diagnostic non-invasive biomarkers and new therapies, scientific evidence-based, with better results in survival, but also in quality of life. This white paper, I am sure, will be very useful because it's a very informative document on preventable and even curable diseases before liver disease or cancer develop. The document leaves not one behind. That's why it means a lot in the fight against stigma. And although we still have gaps and barriers in Europe, possible solutions are available and can be applied. Thank you very much.
Thank you very much, Teresa, for this introduction. Yes, Teresa was the leader of the team from the part of ELPA regarding preparation of the document. Without further ado, I would just like to introduce to you our first speaker, if I may. It's a little bit earlier than we thought, but I think it's a good thing. So it's my pleasure to introduce you to introduce John Ryan. He's Director of Public Health, Country Knowledge Crisis Management at DG Sante at European Commission. In the same department, he was the head of unit responsible for health threats, health information, the cancer program, the pollution-related disease program, the drugs prevention program, the health monitoring program, the health promotion program, the rare disease program, the injury prevention program, and probably I could go on and on and on and use these 15 minutes just to do the proper introduction. But I will just say, sometimes it does happen that you have the right person at the right place. And I met his colleagues and himself on several occasions. I saw the work that was done by European Commission led by Mr. Ryan. And I need to say that European Commission has made great progress in the field of health in a few years. Even when the COVID was not here and people were not thinking about health, Mr. Ryan was leading his team in a way that health was all the time an important at the agenda of European institutions. So it's my pleasure to have you amongst the speakers. Mr. Ryan, the floor is yours.
Thank you very much, Marco, and thank you for the kind words. And I'm sorry you got the long version of my CV. I'll send you a short one next time. I'm fully aware, and I think the Commission colleagues are aware of the substantial impact of liver cancer on the lives of patients and the burdens on our already stretched health systems. I'm very pleased with the action of the Digestive Cancers Europe and the European Liver Patients Association to keep the issue of liver cancer on everybody's agenda. Today's release of the white paper on liver cancer is a good example of this, where you bring together the different elements in a concise and very focused way. Governments and public health authorities, of course, alone cannot address the increasing health, social and economic challenges associated with cancer. We need the commitment of various stakeholders, including the pharmaceutical industry, the research community, patient groups, and of course, oncologists. The European Cancer Plan is based on this and takes a holistic health in all policies and multi-stakeholder approach in addressing cancer. We have, I think, ambitious targets and actions on prevention, on early detection, on diagnosis and treatment, and also very importantly, the quality of life and survivorship issues. We hope that the incidence and mortality of liver cancer will benefit from these different actions over the lifespan of the cancer program. From the point of view of rolling out this plan, the Commission has set up a governance with the member states, with the Commission departments, and with the wider stakeholder community, and all of these groups are now active. We've also started spending money, which is good news, I suppose, as well. We have launched 12 action grants and 4 joint actions with the member states already this year under the EU for Health programme. And we hope that some of these activities will also be relevant for liver cancer prevention and care. Now, just a few words on research and innovation. You know, we have the EU research programme, the EU Horizon Europe programme, which will see a strong boost in research, innovation, data collection, digitalization, new technologies, pharmaceutical development, and so on. And we hope that liver cancer treatment and care will benefit from this research program. Particularly, there is a European health data space which is being planned. We have in the cancer plan a knowledge center on cancer, which will bring together a lot of the activities related to collection of data in the registries. And we also have a cancer imaging initiative, which will be set up next year, which will develop a sort of an atlas of cancer-related images, which we hope will improve screening and diagnosis. In the coming year, the cancer plan and the research mission on cancer will influence research, digitalization, delivery of care. in I think a significant way. A few words on prevention, because that's an issue you have focused on as well in your white paper. There has been a lot of work going on in recent years, particularly with the World Health Organization and the European Centre for Disease Prevention and Control, to eliminate viral hepatitis B and C. The Third Health Programme has already invested a lot in this target, also focusing on vulnerable groups. And Horizon Europe has invested about 51 million euros on this particular activity. The WHO goal is clear. Viral hepatitis must be eliminated as a major public health threat by 2030, and it's a global and a European goal. Europe is a low prevalence region for hepatitis B and C, but many people are still affected, particularly in specific risk groups. Both types of hepatitis affect member states disproportionately, and they also affect people in a disproportionate way. The Commission is therefore working with the World Health Organization, the European Centre for Disease Prevention and Control, and with the member states in order to try and reach this target. And we think that the cancer plan is an additional instrument to help us reach those objectives. The Commission will help to ensure access to vaccination and treatment for hepatitis B and to treatments to prevent liver cancer associated with hepatitis C. In particular, next year, we will propose a council recommendation, in other words, a legal instrument on vaccine preventable cancers to help address the cancer risks associated with hepatitis B and human papillomavirus infections. And also this year, under the EU for Health programme, we will be financing a number of action grants to support access to HPV vaccination. And those action grants will be for NGO groups and also funding for the member states. Now, in terms of prevention and lifestyle, we are trying to influence through the cancer plan the development and redevelopment of the agri-food promotion policy. You know, the Common Agricultural Policy has a specific part related to food promotion, and we want to try and review this in a way which encourages the consumption of fruit and vegetables, particularly through the EU school fruit, vegetables and milk scheme, but also in the area of legislation, we'll be looking to improve the nutritional labeling on alcohol products and also putting a health warning on alcohol products, probably in the course of next year. And of course, the tobacco legislation dates from the first cancer plan already back in the 80s. And our hope is to create a tobacco-free generation where less than 5% of the population uses tobacco by 2040, compared to 25% today. So, I mean, that's a fairly ambitious target. It requires prevention measures, but it also requires the use of taxation and labeling and so on and so forth. So we hope to use all the levers and tools that we have at the European Union level, working together with citizens, of course, and young people to try and reach this ambitious target for a tobacco-free generation. The issue of early detection and screening is very important, and we will be considering the extension of existing cancer screening beyond breast, colorectal and cervical cancer to include additional cancers. And this is being analysed at the moment by our scientific advisors in the Commission, and we hope to propose a change in our cancer screening recommendations next year. You know, some issues around diagnosis and treatment, perhaps, where we think that the cancer plan can contribute to interspeciality cancer training programs, you know, to build up a multidisciplinary cancer workforce. This is something which we're actually financing already this year. Secondly, we hope to focus on structures as well and to create a network of comprehensive cancer centers where patients can receive high standard, quality assured diagnosis and treatment, and also cross-country collaboration, you know, with the cross-border health Services Directive, which allows this sort of cooperation between health systems. There as well, we've also launched some financial assistance for this development in the member states. The third area in diagnosis and treatment, of course, is pharmaceutical strategy. And the Commission will be proposing a pharmaceutical strategy already this year. And we hope that the cancer plan will benefit from that, that new initiative. But in order to measure all of this, I'd like to draw your attention to a new initiative, which is the Cancer Inequalities Registry. And the work is already well in progress on this. And the idea is to measure, in fact, the differences in access to medicine, access to treatment. We saw some very scary figures yesterday from Eurostat showing the huge differences that exist in access to mammography in the different member states. This sort of difference is really not acceptable anymore in a European Union of health. Now, a lot of this depends on buy-in from citizens as well. And therefore, we're hoping to relaunch and strengthen the European Code Against Cancer. This is a list of 12 key messages on prevention, which we hope to relaunch to citizens, covering issues like the use of tobacco, alcohol, diet, body weight, physical activity, and so on. And we really hope that this will form a basis for a scientifically validated basis for prevention campaigns, which we'll be supporting through different apps, for example, mobile apps, but also different lifestyle campaigns. And the whole issue of literacy, of course, particularly for disadvantaged groups, is really important so that they understand these messages. Now, in my closing remarks, I'd just like to say, Marco, that a multi-stakeholder approach of the type that you have taken is exactly the type of support which we are looking for in this implementation phase. We need to involve all of those working in cancer, whether they're on the treatment side or on the patient side or on the pharmaceutical side indeed. And we're very pleased that the European Liver Patients Association has already joined our stakeholder contact group. And I've invited Digestive Cancers Europe to do the same, to join this effort of working together with other stakeholders. We will be setting up the groups in the autumn. We've already received the applications. We're checking the conflicts of interest at the moment. And we hope to really kick this off in the coming weeks. And just as a takeaway message, maybe I might say that our aim should be to inform and educate citizens and health professionals as well, so that they can promote healthy and active lifestyles, incorporating prevention messages. And this includes, of course, for liver cancer. So thank you very much for all your work in preparing this white paper. And I really hope it gets the attention it deserves. Thank you.
Thank you, Mr. Ryan. Marco and I have split this, leading this workshop. So I have the pleasure to thank you for being with us today, for recognizing the impact and burden of liver cancer, as well for all the work that European Commission is doing for the activities under the cancer plan. And most certainly Digestive Cancers Europe welcome the opportunity and will join the working group, because we do recognize how important it is to work with all different stakeholders and the policymakers at the European level. So thank you once more for this very comprehensive presentation of the work that is being done at the European level. I know that you now have to go, and you have already given us the take-home message, which is that we should all work to inform and educate citizens and healthcare professionals on healthy lifestyle. And this is something that we plan to do in future. So the next speaker for this event is Professor Bruno Sangro, who is the director of the liver unit and co-director of hepatobiliary oncology area at Clínica Universidad de Navarra from Pamplona, Spain. He's also professor of internal medicine and leads an active research group in the Spanish Network for Biomedical Research on Hepatic and Digestive Diseases, focused on therapeutic innovations in the field of liver cancer. He currently serves as president of the International Liver Cancer Association, and Professor Sangro will talk about the research in the area of liver cancer. Professor Sangro, you can start your presentation. I guess that you would like to share your slides, or would you like us to share the slides?
I will share my screen momentarily, but I would like first to thank you for the invitation, DiCE and ELPA, for being here, and enormous congratulations for the white paper. This is an initiative that was much needed, and is certainly not the end. It's just the beginning of an effort in which patient associations and scientific societies have to go hand by hand, because we need each other in the effort to make better outcomes for patients with liver cancer. Task today is to speak a little bit about research in liver cancer, and I'm not going to go into many details. I just want to highlight what is the importance of doing research in any specific activity, but certainly in liver cancer. And mainly, we have to start by acknowledging that there are uniqueness in liver cancer, but probably the most important one is that opposite to other cancers, where the factors that cause normal cells to become malignant act directly, in the case of liver cancer, these causes, which are mostly chronic viral infections, alcohol abuse, the metabolic syndrome, and some others, act predominantly by damaging the liver throughout a long period of time, in which the liver becomes progressively less healthy, usually reaching the state of cirrhosis before liver cancer appears. And of course, in this journey from healthy liver to a liver with a chronic liver disease, ending up in a liver with a cancer, there are also some factors that may increase the chance of that disease ending up in developing a tumor. And this is important because this introduces the fact that the population at risk is mostly identifiable because it's mostly patients with an established chronic liver disease, beyond the presence of those causative factors. Of course, the best thing we can do, and John Ryan has talked about this, if we want to tackle the problem of liver cancer, is prevent it. And this is largely a preventable cancer, but Maria Buti will talk about this later on. What I would like to focus is on how research in early detection and treatment of liver cancer can change life expectancy and help reduce premature deaths due to liver cancer. Early detection is important. The aim of early detection, of course, is to detect the disease at a stage where it could be more easily treated, where treatments could be more effective, where the chances of cure could be higher. And here, again, we have to focus on the patient that has a chronic liver disease, known or most likely in many cases unknown, because the chronic liver diseases are usually silent. And it takes a long journey for a tumor cell that has acquired the capability of becoming malignant to develop a detectable tumor, and ultimately, if untreated, grow up to the point where it compromises a patient's life. And there is a window that we already know that goes from the stage where the disease is detectable by ultrasound. This is the tool that we use currently for early detection, to the point where patient becomes symptomatic, as this is what we call the screening window. Again, Maria Buti will talk about this. But let me take into your mind the idea that it is indeed a long journey, that coming from the first cell to the point where disease is detectable by ultrasound. Usually it takes more than 100 million cells for a tumor to become detectable. And of course, we cannot detect a single cell in a human being, but if we have better tools to detect tumors when they are not yet identified by ultrasound, but yes, by other means, and we have good means of imaging small tumors, we can increase the screening window. And by detecting patients at earlier and earlier stages, the chances of having cure for liver cancer would be increased incomparably. This takes us to a situation where in a population at risk, we have a patient with a visible liver tumor, but some other patients with invisible. By invisible, I mean invisible to the current imaging procedures for screening, such as ultrasound. Of course, there are a number of pitfalls for screening these patients, and this has to do with the possibility of having false positive or false negative results, resulting in problems for patients, anxiety, unnecessary invasive tests. We have also the problem of overdiagnosis, diagnosing cancer in patients that otherwise would not have a different prognosis, patients that are too elderly or patients with comorbidities. But we also have the problem of oversensitivity. Now, where are we in terms of screening in these pre-identifiable, pre-US ultrasound situation? We have currently a number of biomarkers that are basically looking in the blood for proteins that are secreted by tumor cells. Alpha-fetoprotein is what's mostly used, but we have others. And these tests can be combined, and then the sensitivity and specificity increases. And these can even combine with age and gender, for instance, in what we call the Gallup score. And with this, we can reach, and this has been validated in different regions, good sensitivity and good specificity, around 80% for both. These are good news, but if we look at this in another way, we can say, well, we cannot be sensitive enough in 1 out of 5 patients. We cannot be specific enough in 1 out of 5 patients again. So there's room for much progress in the possibility of having effective blood biomarkers that are simple and ready to use. And the research here is basically based on identifying tumor products that are shed into the bloodstream directly from living or from dying tumor cells. And these could be circulating tumor cells themselves, or the content of tumor cells that is highly specific, that cannot be mistaken for instance, proteins produced by normal cells, such as alpha-fetoprotein. And this is mainly circulating DNA with tumor-specific mutations or methylating status, or circulating RNA, a different component of tumor cells. There is a lot of research here, and in the coming months and years, we will see definitely better biomarkers that could help increase the effectiveness of screening procedures. We need these biomarkers not only for early detection, also to allow accurate diagnosis, differentiating liver cancer from benign liver tumors, even in cirrhosis, for allowing a better treatment allocation, saving time and money for patients, for monitoring well the response to treatment, and for predicting prognosis. So these simple, friendly, affordable biomarkers are a major matter of research today. But of course, for patients that are already diagnosed, what we can do most is to allow better treatments. And here, research has been increasingly important, basically across the tumor stages from very early to very advanced in liver cancer. The kind of tools that we can use vary. In earlier stages, we use surgery and ablation, including liver transplantation. And the research there is focused on maximizing the options for cure and minimizing the risk for patients and selecting less risky, more tolerable, but at the same time, more effective ways of acquiring a cure for patients. In the most advanced cases, the research is basically focused on developing more effective therapies and more than that, individualizing the treatment. And we have made terrible progress in the treatment of advanced stage treatment in the last years. I will put some examples of hepatocellular carcinoma, which is the most frequent liver cancer. This applies for cholangiocarcinoma, which is the second most frequent liver cancer. For HCC, for instance, you see up to 2007, only 15 years ago, we had nothing. We had no systemic therapy because HCC is as a tumor that is very resistant to conventional chemotherapy. Only then we had one targeted therapy, sorafenib, that was useful in delaying tumor progression and expanding life expectancy. But in the last 5 years, based on active research, we have come with up to 7 different new drugs that are active in this disease, active as first line, active when other drugs have failed in the second line and third line, and many of these are approved for their use in Europe. Some others are still not in Europe, and now we're coming to a situation where our focus is in combining those effective therapies. How relevant is this can be seen for a number of facts. This is just to illustrate that from nothing, we've come to a situation where we can transition from one therapies to the others. And by doing so, by sequencing effective therapies, we can improve very significant the life expectancy of these patients, and even hoping for downstaging these patients for more radical, potentially curative therapies. Just a couple of figures on this that highlights how important the research is. Now the systemic therapy of HCC is based on immunotherapy. We can see that for immunotherapies agents given after progression to an oral drug, I would not mention the drug, 15 of those patients respond with tumor shrinkage. And for those 15% of patients that respond, more than 50% of them are alive 5 years after treatment is initiated. This is an enormous achievement because we're talking not about patients with small tumors. As you can see on the right-hand side, we are talking about patients with liver metastases, or in the bottom, patients with invasion of the tumor vessels, a situation where surgery is not possible, where transarterial therapies are not possible, patients that in the absence of disease, of treatment, have a grim prognosis. Hope for very good outcomes in a subgroup of patients, a subgroup that has increased as we now are combining treatments. And we certainly are starting to see patients with advanced stage disease that reach very prolonged survival terms, and even going beyond 5-6 years, have a chance to really cure. These immunotherapies are already available where they are available for the advanced stages, but now they are under research for investigation in the early stages. And if they show to be active here, certainly they will change entirely the prognosis of patients with HCC, and this is also the situation to a lesser extent, yet a step behind for cholangiocarcinoma. This has translated in an increase in life expectancy for the broad population of patients with liver cancer. These are series of consecutive patients treated in European centers mainly, but also Japan, in consecutive periods of time. And you can see 3-year survival terms having increased. The last one is a bit old. We don't have this kind of series published for the last years, but I can tell you that it's around 50% at least of the patients that now have reached this life expectancy. And what is more important, we have more patients that achieve prolonged 5, 6, 10, 15, 20 years life expectancy terms. So take-home messages for me today. Screening patients at risk with available tools saves life, but we expect better tools to come based on active research. Systemic therapy has certainly changed the life expectancy of patients with a more advanced liver cancer, and because of research, better therapies for more patients are yet to come. And most of all, my main take-home message, more investment in research is needed. But not only that, research would be futile if we don't secure access to screening and to useful therapies for liver cancer for everyone, everywhere. And this is the most important end result of research, providing tools to improve patients' life and quality of life for everyone, everywhere. Thank you very much.
Thank you very much, Professor Bruno Sangro, for this excellent presentation, which has given us an overview what is happening in the field and what we can expect in the future. Of course, from our side, ALPA's side and DiCE side, we will do the best as we can to inform the general public about the research that is going on, because we see also a small lack on people knowing the work that is done in the field. Thank you very much. So without further ado, it's my pleasure to introduce you to our next speaker. He graduated from medicine, then he did a PhD in public health and health management, then he did a degree in law, and after that he did a degree in diplomacy. So with all these skills, we are happy that he is on the side of liver patients. So we started working together a few years ago. We had worked on several issues that are concerning liver patients. And it's my great pleasure to introduce you to the member of European Parliament and the member, a co-chair of the Friends of the Liver group that is in European Parliament, Mr. Cristian-Silviu Buşoi. The floor is yours. Welcome.
Thank you so much. And I'm really honored to be here with you today. Thank you for the invitation. And thank you for the good collaboration. It's true that we've been in contact and we tried to work together and to achieve good results in order to increase the knowledge and the awareness on the liver patients since many years ago. So for me, it's a pleasure and an honor. I would like to thank ELPA and Digestive Cancers Europe for the invitation to the launch of the white paper. 2 years after launching in European Parliament another white paper, The Burden of Liver Disease in Europe, dedicated to improve the situation for people living with liver diseases across Europe. I would like to greet ELPA's president, Mr. Marco Coreniac, as well as DiCE CEO, Mrs. Zorana Maravic, and Dr. Teresa Casanovas Taltavul, president of ELPA Scientific Committee. I'm also very much involved in increasing the awareness on healthcare issues in general, as I'm also the president, the chair of Industry Research and Energy Committee, and research is extremely important for liver diseases and for cancer. And also as the rapporteur, the responsible person for the European Health Programme, EU for Health, on behalf of European Parliament. Chronic diseases do not know any borders. Liver health is of utmost importance. There is a world-growing concern that more and more citizens suffer from a chronic liver disease, and there is a high number of patients diagnosed with liver cancer. We are at a crossroads in our fight against cancer in general and liver cancer in special in Europe, but this fight is not easy, it's very difficult, and unfortunately, when we talk about liver cancer, more than 98,000 European citizens are diagnosed with liver cancer, and around 89,000 died from the disease every year. Liver cancers are extremely costly in terms of human suffering, general practitioner and hospital visits, and premature loss of productivity. At the same time, many people are now aware of many risk conditions, but we need to emphasize more the ways of preventive care. Chronic liver diseases, harmful alcohol consumption, obesity and diabetes, hepatitis B and C are considered liver cancer risk factors. Liver cancer primary prevention should focus on these risk factors. To beat liver cancer, major health policy interventions should secure information to the general population about the diseases, screening patients at risk, universal vaccination against hepatitis B, universal treatment of hepatitis C if indicated, and we have now all the treatment options that we need. Prevention of heavy alcohol intake, be ambitious regarding alcohol-specific legislation. We need also prevention and control strategies of overweight and obesity, the promotion of education of healthy lifestyle. We need also universal implementation of surveillance programs. We need new tools for early liver cancer detection. And of course, we need to continue to support and incentivize via Horizon Europe, but also giving the right incentives to the industry, the development of new therapies for improving outcome, because here is still a lot to improve, a lot to discover, a lot to research. The right treatment given at the right times improves liver cancer patients' health and quality of life, and of course gives a chance to these patients, even that of course liver cancer is one of the most difficult to treat among all cancers. The COVID-19 pandemic has caused also massive disruption to people across the world, presenting challenges that we have not encountered before. And beside, of course, the tragedy of those patients infected, those patients which lost their lives, their families, also patients which had heavy conditions with repercussions, and of course, which are still suffering from the disease. It is also extremely worrying for patients from other morbidities, and of course, patients with cancer were among the most concerned, because due to COVID-19, most centers have reported delays in hepatitis C treatment, and for many patients, the COVID-19 pandemic has also affected the availability of clinical trials. And one of the important targets, one of the important things that we should do now is to reestablish a normal path in treatment and screening. The role of the patient associations in liver cancer is crucial. Of course, it is based on updated and scientific information, especially focused on prevention and early diagnosis, since nobody would be better than a patient to inform another patient. A health literacy strategy is a key aspect of patient empowerment, a key strategy for addressing health inequalities and for effective prevention strategies. We have also, as I said, some important tools in order to support your fight from European institutions. I mentioned Horizon Europe. I was responsible for the health strand, and we have there almost 7 billion for research in general, but cancer is a top priority, strategic priority, and the mission for cancer is one of the 3 missions established before even the final political agreement took place. So good opportunities for our researchers, universities, academics, and hospitals. And we have the program that I mentioned that I was responsible, EU4Health program, as the 4th health program of the Union, a separate instrument for 2021-2027 period, with the capacity to deliver on forthcoming worrying realities, future pandemics and health threats, and also help to make our health systems more resilient, including by digital transformation and by making medicines available and affordable. And we introduced in the EU4Health program a reduction of the burden posed by chronic diseases through better prevention, diagnosis, and care as a key program objective. In addition, the establishment of transnational networks of excellence is included as an action in the EU4Health, and this builds on the possibility to extend the existing European reference networks beyond rare diseases to communicable and non-communicable diseases of major impact and with a high prevalence. And this is what we asked to European Commission. It is also very important that we see in the EU4Health adequate funding for the fight against chronic disease. And here also, as in the Horizon Europe, the cancer is extremely important and is a priority. So for the first time since I had the honor to be a member of European Parliament representing my country, Romania, and of course fighting mainly in the field of healthcare, I see a good momentum for healthcare at the European level. I see for the first time a strong political will, also determined by the COVID-19 pandemics, and decision makers and general population understood that we need to have more prerogatives and more action at the EU level, despite the treaties and despite the fact that the member states are still responsible and there is still the principle of subsidiarity. We have good funded program. Of course, it's never enough. We have more projects than the possibility to fund them in Horizon, in EU4Health, in Digital Europe, in the cohesion funds, in the Recovery and Resilience Facility, where member states were invited to invest in health, and my country, Romania, used a good part of this resilience and recovery facility for healthcare, and the cancer patients also will benefit from better conditions. So with all these tools and with the good momentum, I strongly encourage and support you, and also I can speak behalf of many colleagues from European Parliament in achieving your goals. And congratulations again for the excellent white paper and for the strong commitment and good initiative. Thank you so much.
Thank you, Mr. Buşoi. I think this is very important for us at DiCE and ELPA, patients and citizens across Europe, to know that there is a recognition of the burden of cancer in general and liver cancer more specifically, and that there are so many tools that can help us, help the researchers across Europe to win in this fight against liver cancer. I think now, because at the beginning you said that we should all be working to increase the knowledge and awareness on cancer in general and liver cancer. I think this is one of the reasons why we are organizing this meeting in October, because this is considered to be Liver Cancer Awareness Month. But not just in October, we are raising awareness on this disease that is costly, based on the research that we did. It costs European Union 4 billion euros every year. So as somebody said today, this white paper is just the beginning, and I hope that in the coming years we will see the situation improve. Thank you once more. And now I will continue. Our next speaker is Professor Maria Buti. who is the professor of medicine in Valdebron, Barcelona, Spain, and is also EASL Policy and Public Health Chair. Professor Buti, the floor is yours, this virtual floor.
Thank you, Zorana, for the introduction. I also would like to congratulate for the white paper. It's a very important initiative, so congratulations. And my task today is to talk about screening and prevention. Liver diseases is now the second leading cause for years of working life lost in Europe. And this is very important. This is the result of the EASL Lancet Commission showing that liver diseases are the second leading cause for years working life lost in Europe. And we have to pay attention to this. And chronic liver disease means that these patients can progress to fibrosis and liver cirrhosis, and finally, some of them can develop hepatocellular carcinoma. So patients with liver cancer usually have two diseases, liver cirrhosis and hepatocellular carcinoma, and we need to tackle both. Particularly, we need to prevent liver cirrhosis, and then we are going to prevent liver cancer. Liver cancer is rising in the majority of European countries. The majority of liver cancers are related to hepatocellular carcinoma. And we know that liver cancer is the sixth most common type of cancer in the world. It's the third most common cause of cancer-related death. And overall, there are more than 800,000 deaths per year related to liver cancer. And one characteristic is that the majority of liver cancers are diagnosed late. That means when the patient survival is very, very short. And for the reason, it's very important early diagnosis and prevention. Bruno Sangro has shown the most important causes of liver cancer that are chronic viral hepatitis, hepatitis B and C, obesity and fatty liver disease that is clearly rising across all European countries, and alcohol consumption. Looking at viral hepatitis, and these are recent data, the majority of deaths from liver cancer currently are still related to viral hepatitis. Overall, hepatitis B is the main cause, followed by hepatitis C. And the majority of liver cancers are in men, more than in women. So this is, I think, viral hepatitis and gender, it's a risk factor for liver cancer. The majority of patients with viral hepatitis, with chronic hepatitis B and C, are completely asymptomatic. They don't show any symptoms until a later stage of the disease. That means when they have a liver cirrhosis, and then the prognosis, even with treatment, it's worse. And another factor is that the majority or a high percentage of people living with hepatitis B or hepatitis C are unaware of their conditions. And for the reason, it's very important screening for viral hepatitis. We have now different tools that we can prevent and treat viral hepatitis. For hepatitis C, we can prevent with hepatitis B vaccine, and there are a lot of studies showing that vaccination can prevent new infections. And this is really important, vaccination of newborns to prevent transmission from the mother to child of viral hepatitis B, because when hepatitis B is transmitting to the newborns, the risk of chronicity is very high. For hepatitis C, we don't have any vaccine, but we have treatments that we can use as prevention. But to use these treatments, clearly we need the screening for viral hepatitis. I would like to show the importance of vaccination, and these are studies performed in Asia, and you can see in the left of the slide the prevalence of hepatitis B, HBs antigen in blue before vaccination in China, and the important decline in the prevalence of hepatitis B with the introduction of the vaccine. And now there is an important decline next in the prevalence of hepatitis B, particularly in young people, and this clearly impacts on the risk of liver cancer. So hepatitis B vaccine not only protect for acquiring hepatitis B, also reduce the risk of liver cancer. Hepatitis B vaccination in the newborns, it's a general recommendation, but not all the countries have programs. Even in Europe, some countries don't have national programs for hepatitis B vaccination or are restricted. And this, I think, it's an important issue that we need to solve in the next years. Universal immunization of all the newborns. Regarding hepatitis B and hepatitis C, it's very important, the screening, and we need to screen all the people with risk factors. Next, for hepatitis B and for hepatitis C. What about treatment? We can treat patients with hepatitis B with oral antivirals. This is a long-term treatment, but clearly suppress viral replication. And we can treat hepatitis C with also direct antivirals. And for hepatitis B, treatments are very short, and we can cure all the majority of patients. And what is important next is with these treatments, we can decrease the risk of hepatocellular carcinoma. On the left, you have an European multicenter study showing that treatment of patients with chronic hepatitis B with oral antivirals decrease the risk of hepatocellular carcinoma. On the right, there is a study for hepatitis C showing that treatment of hepatitis C, particularly achievement of sustained virological response of cure hepatitis C in patients with liver cirrhosis, decrease the risk of hepatocellular carcinoma from 18 to 6%. So we have the tools for eliminating viral hepatitis, and this it's a goal for the next year. For the next year, achieve elimination of viral hepatitis B and C in Europe. And to do this, we need to do a screening, vaccination, early diagnosis, and treatment. And if all the countries go in this direction, we can eliminate viral hepatitis. Let's move to the other diseases that are increasing, particularly obesity and alcohol consumption, and sometimes both are combined. The combination of obesity or fatty liver disease and alcohol consumption is frequent. We don't have a specific treatment for obesity or for alcohol consumption, but we know that by reducing alcohol consumption and obesity, we can reduce liver cirrhosis and liver cancer. And this is the measures that at individual level people can do, that is reducing alcohol intake, limiting unhealthy foods, and increase physical activity. But in addition to these measures at individual level, we need to do something at population level. And at population level, we have different policy interventions that are clearly to increase taxation in alcohol and in unhealthy food, or trying to avoid this. The minimum pricing for alcohol has an impact in countries that have this policy intervention. And also clearly we have to reduce access, restrictions on marketing and information and support. I would like to finish with the importance of early detection. Also, Professor Bruno Sangro has shown the importance of screening of early detection. Early detection of a small liver cancer allows curative treatments and a greater survival, while if detection is in advanced stage, then we can only have palliative treatment, no curative treatment, and clearly a very short survival. And currently, the majority of liver cancer are detected in an advanced stage, 75%. So what is important is to move to an early detection. The international guidelines show the importance of early detection and screening for all patients with liver cirrhosis. So patients with liver cirrhosis need to be screening, and the way to screen is with ultrasounds plus alpha-fetoprotein, a blood test. And this, there is agreement, there is consensus that the surveillance interval to do this test is every 6 months in patients with liver cirrhosis. So screening is very easy, it's not aggressive, it's only an ultrasounds and a blood test. The problem is that the adherence to screening in the majority of centers is relatively low, and we need to improve adherence to screening. This is two studies performed in France that clearly shows the importance of screening. And in a randomized study in 43 hospitals in France and Belgium, screening was performed, and the rate of diagnosis of liver cancer was very high, 61%. But when there is not regular surveillance in the real life experience, screening is very low. It's only 20%. I show the Chang study, a study in the real life, and then the rate of diagnosis of liver cancer in a curative phase is also very low, and clearly this impacts survivals. So the main message is the importance of regular screening in patients diagnosed with liver cirrhosis. So my final message is a call to a multiple level action in primary care, in liver clinics, in academic centers to identify patients with chronic liver disease, patients with cirrhosis, and then start surveillance programs. But this is an action on individual level, and we have to go more to a policymakers action. And I would like to finish with the 10 asks to the European institutions. That is an EASL initiative in collaboration with main organizations. It's to the 10 asks to the European institutions to improve liver cancer care and prevention. And I would like to request to add your voice to our fight against liver cancer, and please sign our open letter now that is now available at the EASL webpage. Thank you very much for the invitation.
Thank you very much, Professor Buti. It's good to know that we have some activities that we can do as a community to help your engagement in the field of helping liver patients. I should note that since you became the leader of the Policy and Public Health Commission at EASL, the events at this commission and also the policy work of EASL have significantly improved in the last years. So thank you for your work. And I will just go to our next speaker. So what to say? So she is the head of the viral hepatitis unit and the head of ST, the outpatient service at the Clinic for Infectious Diseases and Febrile Illnesses at the University Medical Center in Ljubljana. She's, of course, the full professor of infectious diseases and epidemiology at the Faculty of Medicine. But rather than all the titles that she has and all the commissions she's in, of course, also at the Public Policy and Public Health Commission at EASL, I would like to stress that she is better known by the results that she produces at the national and international level. So when the COVID crisis started in our country, she was the first doctor to say that we need a call center. She just didn't say it, she organized it, the activities and services to help the general public facing with the crisis. And she did the same thing for fighting liver diseases in Slovenia. It's my pleasure to introduce you, Professor Mojca Matičič.
Thank you very much, Marco, for such a kind introduction. And it's really a great honor and privilege to be here with you today. And I'd like to thank the organizers, ELPA, DiCE, and particularly you for inviting me to this prestigious meeting and to present you the voice of Slovenian presidency of the Council of the EU. But first of all, let me congratulate you on preparing and launching this very important and badly needed document, the white paper, and thank you so much for your huge engagement here. So why the voice of Slovenian presidency of the Council of EU regarding the awareness of liver cancer? Well, as you may know, since July this year, Slovenia has been holding the presidency of the EU Council, and this comes just on the heels of the Europe's Cancer Plan, which was presented, as you may know, at the beginning of this year. And we all know that while cases of liver cancer have still been on the rise, the public awareness for it appears to be unfortunately much lower than for other cancers. And besides, liver cancer is the deadliest cancer that can be prevented because risk factors are very well known, as we've heard, and well manageable, as we've also heard today. So Slovenia strongly supports this European Beating Cancer Plan proposal that recognizes, as we've already heard, the importance of identifying and managing the main risk factors in liver cancer, such as, for example, facilitating access to Hep B vaccination, enabling treatments for Hep C and Hep B, preventing harmful alcohol consumption, preventing strategies that should be implemented for raising awareness of obesity and type 2 diabetes through, as we've heard, limiting marketing and promotion of sugary food items. However, aside all these strategies to prevent liver disease leading to liver cancer screening and early diagnosis are actually a key to reduce the liver cancer-related mortality. Thus, already existing targeted cancer screening should be expanded and should include screening for additional cancers, such as liver cancer, which actually needs to be considered in the new EU-supported cancer screening scheme. So, here comes Slovenia again, and under the umbrella of Slovenian presidency of the EU Council and supported by several Slovenian associations and authorities, the EASL and ELPA jointly organized last Friday, so on October 22nd, a special liver cancer awareness event to underline the much needed action for screening and early detection of liver cancer and its prevention by joining the crucial stakeholders under the same roof. So the medical experts, the patient representatives, as well as the EU policymakers, as you did today as well. Let me just briefly represent you the outcomes of this event. So the medical experts from the hepatology community highlighted the need for liver cancer screening and health promotion by presenting the existing data. So the burden of liver cancer in Europe, the tools that we have for prevention, early detection and treatment, as we've already heard today as well, and the need for early detection and monitoring patients for liver cancer, which are the key if we would like to see a change in the increasing trend of liver cancer cases in Europe. Besides, as just Professor Maria Buti has shown, 10 asks by EASL to improve liver cancer care in Europe were also presented, and an invitation to sign the EASL open letter was given there as well. And importantly, a call to multiple level action was addressed to all the stakeholders, starting with the primary care, liver clinics, and academic centers, to be considered all in the new supported EU-supported cancer screening scheme. So the patient representatives at that awareness meeting shared their real-life experiences from their countries, their views, their worries due to none or low awareness on liver cancer and inequalities. Because actually we cannot have a successful screening and early detection program if we do not take actions to eliminate the challenges that are related to the inequalities to access to care in Europe. And last but not least, there were the policymakers. They discussed thoroughly the existing European Cancer Plan proposal, recognizing the importance of dealing with and identifying the main risk factors in liver cancer, as we've heard today as well. But besides, they confirmed their commitment to updating the EU Council recommendations on prevention and to consider screening and early detection based on the firm study data to be included into the new EU-supported cancer screening scheme, as was already presented today by Mr. John Ryan. So to summarize the key policy recommendations from the EASL-ELPA liver cancer awareness date, two main key bullets were the updated council recommendations must include liver cancer screening because we do have suitable, affordable tests as well as effective treatment and so on. And it's very important to enhance patient surveillance programs to improve liver cancer detection by targeted surveillance programs for at least patients, by awareness and by education programs of both patients and practitioners. So to go back to Slovenia, in the area of prevention of liver cancer, Slovenia is particularly well recognized for its successful management of viral hepatitis, particularly viral hepatitis C, which is on track to its elimination. So Slovenia actually represents a model of HCV management, and it serves as one of the WHO best practice examples. As we've just heard from Professor Maria Buti today, treatment for hepatitis C works as prevention of liver cancer. It works in two directions: on the individual level, because Hep C is a curable disease, and it also works on the public health level since it prevents further spread of HCV infection, as you can see here, in high-risk populations. And so with the advent of new highly effective and safe drugs, for hepatitis C, in 2016, the WHO set up the first global health sector strategy to eliminate viral hepatitis as a public health threat, with quite ambitious goals to decrease HCV-related mortality due to cirrhosis and liver cancer by 65% by the year 2030. But in reality, as was shown by the recent WHO progress report, in Europe, only a quarter of HCV infected have so far been diagnosed, and only a third of those have so far been treated. Because the problem is that HCV infection most commonly affects the marginalized, the vulnerable, and the underserved populations, rising inequity in its management. And besides, the most striking problem that we've already heard today is that the natural course of HCV infection usually progresses silently for decades, and the infected are actually unaware of it for a very, very long time. So the modeling projections have clearly shown that the best global intervention results towards hepatitis C elimination can be achieved by scaling up testing and treatment. Therefore, it's of utmost importance to find and cure the infected as early as possible. So in a 2 million population of Slovenia, the HCV prevalence study, so the national prevalence study, was unfortunately not performed. However, already in the early 90s, several studies revealed high HCV prevalence in some high-risk populations. And in 2015, it has been shown that 2/3 of infected reported IV drug use as the mode of infection. So how has Slovenia been managing hepatitis C? Well, the national strategy for the management of Hep C was set up way back in 1997, just integrated the hepatitis C continuum of services such as HCV testing and treatment into the routine healthcare activities. And since then, hepatitis C treatment has been performed at 5 centers around the country, mostly by infectologists. It's been available and accessible to everyone. It's been completely covered by the national health insurance system with no restrictions. And very importantly, there's also been a register set up with 1997 of all the treated, and treatment efficacy has been evaluated since then on the national level, which is very important for the monitoring system. In 2007, special focus was directed to people who inject drugs by just integrating 5 viral hepatitis treatment centers and 18 centers for treatment of drug addiction. And this network very quickly yielded some amazing results in increasing the treatment rates in drug users. So with the advent of new drugs, model projections showed the WHO elimination goal is feasible in Slovenia by slowly increasing the testing and treatment rates. However, we wanted definitely to speed up this process. And so we accelerate the testing and treatment rates through active case finding. What does that mean? So for the general meaning, it means that algorithms for testing that were based on risk factors, extrahepatic manifestations, some unusual signs and symptoms, and so on, was introduced into a routine clinical practice. And testing in Slovenia can be performed at various places within the healthcare system, as well as within the community. And the most recent reports show practically no HCV positive results that were performed while testing the general population. But for the population at high risk for infection, active case finding was precisely performed for those who are under regular medical supervision, as well as for those special populations, such as people who inject drugs and prisoners. So by 2018, a so-called micro-elimination was completed in several high-risk groups, meaning that there are no more Hep C cases among Slovenian hemophiliacs, hemodialysis patients, organ transplant recipients, HIV co-infected. As for people who inject drugs, the interventions were adapted to their specific needs, and in those that were managed at various programs such as substitution treatment, the modeling studies and real-life data showed that, as you can see here, microelimination is definitely feasible by the year 2026. However, for those drug users at large, mobile outreach units will be introduced next year for testing and linkage to care. And as you can see here, the number of diagnosed, treated, and cured has been increasingly improving during the last 4 years. And taking together all the data presented and guesstimating the national HCV prevalence at 0.23%, in Slovenia, estimated 86% of infected have so far been diagnosed, and estimated 62% of infected have so far been cured. But there's still a long way to the end of the story. But the burden of HCV-related liver cancer in Slovenia has so far not been evaluated. However, we have a good example in a cohort of well-studied hemophiliacs in Slovenia who managed to eliminate hepatitis C in 2018. And this close analysis of this cohort has shown that among 73 of infected, 3 of them developed liver cancer. 1 of them refused hepatitis C treatment, 1 of them was a late presenter to treatment, and 1 of them was unsuccessfully treated with previous interferon alpha treatment. However, at the end of the day, we can clearly see that this is all that we need to prevent hepatitis C-induced liver cancer. Taken together, the knowledge on liver cancer and the national data on hepatitis C, the management of hepatitis C, particularly testing and treatment in accordance with the clinical practice guidelines, has been just included in the 3rd National Cancer Plan for the period 22-26, which has just been prepared to be confirmed. So to conclude, ladies and gentlemen, liver cancer is a serious public health concern that still has been in the rise. And the updated council recommendations must include liver cancer for screening and early detection. Suitable and affordable screening tests and effective treatment is available. The needs for suitable program settings for liver cancer are identified and can be implemented. So targeted surveillance programs of at-risk patients must be implemented systematically. Besides, awareness and education programs of patients and practitioners are a key to successful implementation. And last but not least, of course, Slovenian presidency of the Council of the EU strongly supports all these proposed additional activities. Thank you very much for your attention.
Thank you, Professor Matičič, for giving us the voice of the Slovenian presidency of the Council of the EU, and also highlighting once again that screening and early detection are the only way to improve the outcomes for so many European citizens. And also, I am sure that with the great experience that Slovenia has in the field of screening for colorectal cancer, that once the council recommendations for screening are updated and the screening for early detection for liver cancer is in there, that you will do great job in implementing and doing the screening. And I think that, you know, there is so much we can learn from each other. And I think this is why this meeting and similar meetings are important, that we hear from great examples. So we need to move further with our program, and the next speaker is coming from Macedonia. It is Professor Kalina Grivceva Stardelova. I hope I have pronounced the name correctly. And she is the director of the University Clinic for Gastroenterohepatology in Skopje, North Macedonia, and the president of the Medical Chamber of North Macedonia. Professor Grivceva Stardelova is also a coordinator and team leader of the first national declaration for liver cancer in North Macedonia, and she will tell us more about the good practices from North Macedonia. Welcome.
Thank you. Thank you, Presidency of Delpha, for opportunity to be here with you. I will shortly present what is situation in Republic of North Macedonia nowadays. Actual data, official data are showing us the trend of hepatitis B from period from 1997 up to 2007 and up to these days are a curve in increasing. Even since 2004, we have obligatory hepatitis B vaccine from newborn. and voluntary vaccines for healthcare workers and those who wanted to be vaccinated. We have to show that as well as hepatitis C crime is increasing for official data. And since last year, we have available treatment for hepatitis C on University Clinic for infectology disease, as well as the gastroenterology clinic. But I have to say that our register of drug users, it's called White Book, show that we have about 10,000 active drug users, which is one of the reasons why these numbers are increasing. We are trying to early detect those who are under dialysis, those who are going to be on treatment for organ donors to receive or to give organ for helping others. We are going to try to detect all prisoners, but it is a long path from update to the future. The big problem in our country is alcohol abuse. As you can see, it is about 47.2% of our cirrhotic patients is alcohol related, and we have official data from World Healthcare Organization that also alcohol using is in liter per capita increasing, as well as liver damage caused by alcohol using. We have official data that we have about 3,000 registered patients per total population with liver cirrhosis. 14.01 are male, 3.3 are females, and we have increasing number of patients with hepatocellular carcinoma, which is on 6th place for mortality from all carcinomas in Republic of North Macedonia. Recently, we published our data about GI carcinomas, and as well, we can see for the period from 2015 up to 2019 that the numbers of hepatocellular as well cholangiocarcinomas or non-specific liver carcinomas, which are mostly hepatocellular carcinoma, is increasing. So we decide together with our patients to, and of course with our Ministry of Health, to sign first national declaration of liver cancer in North Macedonia, which means that we are going to make some actions to early detect not just drug users, not just hepatitis B or C positive patients, but to early detect hepatocellular carcinomas. We are going to organize a liver center in the University Clinic of Gastroenterohepatology. We have two centers, our clinic, Gastroenterohepatology Clinic, and City Hospital, 8th of September, which are two centers for early diagnostic of hepatocellular carcinomas. And we have one oncology clinic, which is the only clinic for treatment, oncology treatment of this kind of patients. So we collect a lot of people, volunteers who want to do this, and we are going to organize our work a little bit better, just to early detect these patients, to follow up them, early to treat, just to make one purpose, to have like a decrease curve of hepatocellular carcinoma in North Macedonia. Thank you.
Thank you very much, Professor Grivceva. So without further ado, I'm introducing to you our next speaker. She's a state advisor and national coordinator for sexual and reproductive health at the Ministry of Health of North Macedonia. Welcome, Ms. Sanja Sazdovska. The floor is yours.
Thank you for inviting me to this conference and for giving me the opportunity to talk about the topic prevention of liver cancer related with good practice from North Macedonia. I'm a part of this team, but that we have a good practice to show. But I want to say that now I will talk about, on behalf of the Ministry of Health, I would like to highlight the importance of this conference and the issue of being liver cancer in Europe, the empowerment of prevention and early detection in the context of developing policy. How we started. Patient participation in decision-making in health, in healthcare and treatment is not a new area, but currently it has become a political necessity in many countries and healthcare system around the world. Emphasizing the importance of participation in decision-making process motivates us and the healthcare team to promote participation of the patient in treatment decision-making. These efforts include enhancement of patient access to multi-phased information providing systems and tools that help patients in decision-making. With enhanced patient participation and considering patients as equal partners in healthcare decision-making, patients are encouraged to actively participate in their own treatment process and follow their treatment plan, and thus a better health maintenance service would be provided. This above is commitment and goal of the Ministry of Health of Republic of North Macedonia. That is why we recognize the potential of Milan and the association and his association of patients to be our partner in leading the process and the steps forward in order no one left behind. Milan and his team pushed the initiatives to be part of the agenda of the Ministry of Health with many efforts and evidence of its need and importance. How we started working together. During the summer, we had several meetings with the relevant stakeholders in order to find a way for this initiative to gain importance and to be integrated in the healthcare system. Indeed, those meetings were extremely interesting with many fruitful discussions and expertise by the doctors and other stakeholders. As a result of the subsequent events, as I mentioned, the hard work of the non-governmental sector, the expertise of doctors and professors from medical university, and all members of the group make a good condition to adopt the first national cancer declaration. The declaration describes the efforts of all partners to adopt the introduced standards for prevention, early diagnosis, and treatment, with the emphasis on the concept of personalized medicine, which will provide the most appropriate and timely diagnosis, therapy, and monitoring of the conditions and also outcomes of the patient. Ultimate goal is to provide the best options to patients within the existing health framework. The starting point in our program is liver cancer, given the long-term commitment and activities of health professionals. Everyone is committed to setting goals to reduce liver cancer as a public health problem by 2025. Participants in the declaration believe that it's possible and essential to set a goal to reduce the diseases and improve the condition for early diagnosis, treatment, and monitoring of the most common types of cancer in our country, not only the liver cancer, but here it is the lung cancer, colorectal cancer, breast cancer, and cervical cancer, as well as the other malignancies, as an essential public health problem in our country, in dealing with which the concept of personalized medicine could make a special contribution, as well as the approximation to the cancer plan for Europe and the strategy to reduce the diseases in the EU and other countries. A joint action against cancer will be attempt to strengthen cooperation with the partners in all areas, to strengthen the political leadership in our country, to oblige the youth and the civil society to encourage the movement of the masses, rapid implementation of WHO decisions, and also the 5 dimensions of the continuity in this control will be prevention, early detection, diagnosis, treatment, and palliative care, and also the cancer control planning. Therefore, the Ministry of Health and other relevant institutions in the Republic of North Macedonia agreed to begin their responsibilities and commitments of the country for integration in the European Union by developing a comprehensive national plan for cancer prevention and control, including liver cancer, in accordance with the European Cancer Plan. Also, we want our goals as a multidisciplinary team that I mentioned in the previous, as I mentioned, is a multidisciplinary approach for the first time in our country for patients. That I want to express my gratitude and my happiness that what we have as a goal in the Ministry of Health, we show as a good example from Milan and his association of opening a special center for liver diseases, study for early detection, declaration units, most important stakeholders, collaborators and partners from all levels. Also, we have to engage young people and patient organizations for grassroots movements, fast implementation of WHO and EU scientific guidelines, determination in dealing with cross-border health threats, strengthening the national health system, digitalization, implementation of national awareness plan, patient centricity, and also to have no stigmatization about this issue. At the end, but not at the last but not the least, at the end, I wanted to say that one quote, my favorite quote for Mother Teresa is, none of us, including me, ever do great things, but we can all do small things with great love, and together we can do something wonderful. Thank you very much.
Thank you, Sanja. Thank you for sharing the experience of Macedonia, for this inspirational quote, but also by giving the practical example how we should work all together to improve the outcomes across Europe for cancer patients. And I really also want to congratulate Milan, because I know that he's doing a great work in Macedonia, and we certainly look forward to hear in future of how you have improved because of all the things that you are doing, how the situation will improve in the coming years. So the last speaker of the day is our own, if I can say that way, the co-founder of DiCE and the medical director of DiCE, Professor Eric van Cutsem, who will present the liver cancer white paper. So without further ado, Professor van Cutsem, the floor is yours.
Thank you very much, Zorana. Thank you, everybody being present. So thank you very much for organizing this discussion. And what I want to do is to present some work that has been done, not by me, other people should receive the credits. It's a collaboration, as you will see, DiCE and then the liver cancer patient organization, ELPA, as you will see. And they have prepared an excellent document, a long version and then a short version. And what I will do in a few minutes only is take some of the main conclusions. I'm sure we can answer questions if there are, and I hope I would encourage everybody to read this document because it's really interesting. So I'm, as Zorana said, I'm since long time involved initially in Europa Colon and now in DiCE, and helping the team for some scientific and medical aspects. And I'm a professor of GI oncology at the University of Leuven in Belgium. So just a couple of numbers as introduction before I share with you some of the recommendations of the white paper. In 2020, there were more than 87,000 new cases of liver cancer across Europe and more than 78,000 deaths. With that, liver cancer ranks amongst frequent cancer, among the frequent cancers, and also especially amongst the frequent cancer-related causes of death in Europe. And 4% of all cancer-related deaths in Europe are due to liver cancer. Europe has a large burden. We still see an increase in the tumor burden, and heading up a large unit of digestive oncology, GI oncology at the University of Leuven. Liver cancer is an important patient population amongst those with colorectal, stomach, pancreatic cancer, and some other cancers. So liver cancer and it's a frequent topic, and especially also a challenging topic in this situation. And the purpose of this white paper is to assist health policymakers across Europe in identifying key priorities areas for unmet needs in this area, and to guide also the implementation of best practices for liver cancer patients based on currently available evidence. And for that, the team of DiCE and ELPA has been taken into account some specific considerations in that sense, and that's quite specific. That's different with, for instance, colorectal cancer or some other cancers, is that the majority of patients have an underlying liver disease. We know that primary liver cancer occurs often in patients with liver cirrhosis, and there are different challenges. There is a challenge already of the taking care of the cancer, but then there is a challenge also of taking care of the underlying liver disease, and often this goes together because HCC, hepatocellular carcinoma, or primary liver cancer, occurs more often in patients also with cirrhosis and with these different challenges. Early diagnosis is challenging because of the imaging. Treatment is challenging also because sometimes these patients have a poor liver function, have sometimes jaundice, portal hypertension, ascites, so fluid in the abdomen, and that leads to different challenges in this setting. And another important factor is that some of these patients, because of the underlying cause, alcohol being very frequent, increasing burden also of obesity and NASH, and so the steatohepatitis in these patients. So there are sometimes some social stigma in this setting. And then we do know also that the outcomes vary amongst different regions. That's not only for liver cancer, that's also for other cancers, but also for liver cancer. It's clear. And so what is being said in the white paper is to give recommendations amongst these 5 topics. And I will take you through these 5 topics with a short goal and then a short recommendation in this setting in 5 slides. So 1 slide per topic. So the first important topic is to try to optimize the knowledge, the research on liver disease, data sharing through better collection, analysis of liver cancer big data, utilizing cancer registries, and also in the future tumor banks or blood banks for these patients. And also to optimize the knowledge through stimulating research on liver disease, finding funding for different areas of interest and areas of research, looking in biomarkers, liquid biopsies, hepatitis C vaccination, for instance, in the future, hopefully could make a difference in outcome. The reality is that on top of alcohol and steatohepatitis related to obesity, viral hepatitis in some regions is still more frequent. And if you look in some endemic spreads in East Asia, for instance, there is a much higher incidence of liver cancer, also because of the higher incidence of viral induced liver cirrhosis, hepatitis B and C. In the setting for hepatitis B, we can do vaccination programs that's being done adequately, but for hepatitis C, although we now have new drugs so that we can cure hepatitis C, there is still a big burden of hepatitis C related liver cancer in some regions in the world. So it's important to focus on some of these aspects. To optimize prevention of viral hepatitis. I was talking on hepatitis B, mass vaccination, immunization, hepatitis C, the control of transmission, the treatment with antivirals, but hopefully also in the future, vaccination, and then lifestyle factors, of which alcohol and obesity are the 2 most important related to liver cancer in this setting. Early diagnosis, like in any cancer, is crucial. The earlier the diagnosis is made, the better the treatment can be offered. And also in patients with early diagnosis of liver cancer, transplantation, which is different with some other cancers or many other cancers, is for some of these patients an option. So early diagnosis through screening, implementation of screening programs in order to identify high-risk populations is important, and also to monitor especially the outcomes of some liver screen initiatives are crucial and important in this setting, and they're also implementation of early screening with different tools, different programs is crucial, and to do some research on that. And further details of these recommendations can, of course, be found in the white paper. We want, it's clear that an important chapter is that the treatment and the care should be optimized. Like in any cancer patient, a multidisciplinary team is crucial. Here there are some extra dimensions, so as I mentioned already, of the underlying liver disease, where the hepatologist on top of the other caregivers plays an important role, and even also the transplant surgeons and transplant teams do play an important role, and that on itself is already multidisciplinary. The cancer is multidisciplinary, so bringing these teams together is important in this setting, in order also to implement some of the recommendations that ESMO, European Society of Medical Oncology, ESAL, the European Association for Study of Diseases of the Liver, the different organizations, societies have made treatment guidelines with a different focus, but in the end with a similar outcome and a similar goal, different focus starting from the underlying liver disease or starting from the cancer. But in this situation, it's important to try to optimize these treatment schedules, regimens, recommendations in different countries, also via implementation of, for instance, ESAL and ESMO treatment guidelines. And finally, the fifth topic that is further developed in this white paper is the optimization of patient involvement and patient empowerment. It's important, patient empowerment, patient involvement is crucial. That's what we always do as clinicians to try to do that. There is still room for improvement in everything, but it is important to make to think of that. This is also further developed in this white paper, that patient health literacy and support to improve on that with nomenclature, ensuring that patients are adequately informed about the different aspects, going from screening to new research aspects. The family members have to be involved in that, and the patients need to be involved much more in research and research projects in this setting. That's crucial and important. So, and in order to conclude, this white paper will not solve, of course, the issue of liver cancer management, but it can help policymakers also to guide in policy-making decisions, the caregivers, the patients, the physicians, the research projects in this situation. And therefore, these five areas that I highlighted are important in this setting, and there is room for improvement on all these different areas in this situation. And therefore, at DiCE and at ELPA, we call upon the stakeholders across Europe to work together to ensure that best practices are implemented at every stage of the patient pathway in each country. The patient is crucial, the patient is central. It's not words, but it should be reality, so that every patient within Europe can have the best possible opportunity for a positive outcome. And collaboration is crucial in order that everyone has access to what is the right to have access to best practice care, and that no patient is left behind. So that were some of the highlights of and synthetic messages that Zorana Vasiliki and the whole DiCE and ELPA team has been working on very hard with this white book. Thank you for your attention.
Thank you very much, Professor Van Cutsem. And with that conclusion and that last slide, unfortunately, we used all the time that we had today. So I propose that we go slowly to the end. So in regards of any specific particular question, is the message is same as at the beginning of this event. So if you have any questions, you can send it to ELPA, to DiCE. We will do the best that we can, that we answer you very quickly and appropriately. The whole words of the white paper, the whole white paper will be available at the web pages of ELPA and the web pages of DiCE. I would like to especially thank now also Professor Casanovas for her extraordinary contribution to the final text that will be available on the pages, and the medical writer. Of course, we see this as a tip of an iceberg of the work that was done in the last year and a half. And this is also the great starting point for all the activities that we as partners are planning for next year and the years to come. From my side, as the president of European Liver Patient Association, I was looking forward to the collaboration with DiCE. I need to say that collaboration was more than I even expected. So I'm really looking forward to our next projects and next steps. And I give the final word to Zorana. Zorana, please.
Thank you. Yes, I just want also to thank everybody, to thank those who contributed to the white paper development, to thank the teams of DiCE and ELPA for putting this event and doing the white paper. All the materials will be available on the websites of DiCE and ELPA, including the video recording of this meeting, as well as the presentations. And I think maybe the keyword is collaboration, and we will continue working together to improve the outcomes for liver cancer patients across Europe. And I certainly look forward to seeing you all, hopefully live in the near future. Wish everybody a good day, and thank you for coming.